heart attack symptoms, prevention, and emergency response. You're grilling burgers, maybe enjoying a quiet evening, when a weird pressure settles right in the center of your chest. What's your first thought? Probably something like, must be those onions, or too much chili. You grab an antacid, maybe take a deep breath, and keep flipping patties. But here's the chilling truth. Every 40 seconds, somewhere in the United States, another person is doing the exact same thing, dismissing a critical warning and gambling with their life. Thousands never make it to dessert, never see another sunrise, because that first symptom felt too mild to worry about. Today, we're pulling back the curtain. You'll learn how that seemingly mild signal can turn lethal, the surprisingly different ways hearts scream for help in men and women, the 4 crucial moves that can buy precious time while the ambulance races toward you, and the simple daily habits that quietly, effectively keep plaque from ever building in your arteries. Watch this once, and you'll never confuse a little heartburn with a life-threatening heartbreak again. Section 1. What a heart attack actually is. All right, let's get down to basics. Think of your heart as the busiest, most vital kitchen in the world. It's working tirelessly, pumping life-sustaining blood to every corner of your body. To do its job, it needs its own constant supply of oxygen-rich blood, delivered through dedicated pathways called coronary arteries. These arteries are like the delivery doors, ensuring your hard-working chefs, the heart muscle cells, never run out of fuel. Now, imagine what happens if one of those delivery doors gets blocked. If a fatty clot, often formed over years from plaque buildup, a process called atherosclerosis, suddenly seals off an artery, part of that kitchen goes dark. No oxygen, no fuel. Within minutes, those muscle cells, those diligent chefs, start dying. Doctors call this a myocardial infarction. A mouthful, right? Everyone else just calls it a heart attack. The faster we can reopen that door, the more chefs we save, and the more heart muscle stays alive and healthy. Every second truly counts, because when it comes to your heart, time is muscle. Section 2. Classic versus sneaky symptoms. When most of us think of a heart attack, we picture the dramatic Hollywood version. Someone clutching their chest, falling to their knees, writhing in excruciating pain. And yes, classic signs can feel like an elephant sitting squarely on your chest, in intense pressure or squeezing that just won't let up. This pain might radiate down your left arm, shoot up into your jaw, or even spread to your back. You might break out in a cold sweat, feel suddenly short of breath, or experience an inexplicable, overwhelming nausea. These are unmistakable alarms, and you should never ignore them. But here's where it gets tricky, and frankly, a bit sneaky. Not all heart attacks announce themselves with such fanfare. Sometimes the symptoms masquerade as something far less serious. It could be a persistent heartburn that doesn't respond to antacids, or a profound fatigue that hits you even after a good night's sleep. Maybe it's an upper back pressure that feels like a stubborn knot between your shoulder blades, or a weird toothache that hops from side to side in your upper teeth or jaw, without any dental explanation. These are the subtle whispers, and easily dismissed. It's particularly vital to understand that women, older adults, and people with diabetes often experience these more subtle versions. For them, the crushing chest pressure may never even show up. Instead, they might feel lightheaded, have unexplained anxiety, or even just a general sense of unease. The key takeaway: if the discomfort is new, unexplained, and anywhere above the waist, from your jaw to your belly button, don't play doctor yourself. Let a medical professional, not your gut feeling, decide what it is. A little caution can literally save your life. Section 3. Men versus women. Know the divide. While the underlying mechanism of a heart attack is the same for everyone, the way symptoms present can vary significantly between sexes. Men frequently report that classic crushing chest pain, a sensation strong enough to drop them to their knees, often described as an immense pressure or tightness. They may also experience pain radiating down their left arm, sweating, and nausea. It's often sudden and severe. Women, on the other hand, often tell a different story.
they frequently report profound, unexplained tiredness for days or even weeks leading up to an event. Sleep disturbances become common, and they might wake up feeling exhausted. Jaw or throat soreness, a burning sensation in the chest that feels like indigestion, or even just a constant urge to burp that simply won't go away are common yet often overlooked symptoms. Back pain, particularly in the upper back, and shortness of breath without chest pain are also more common in women. While these differences are important to note, it's crucial to remember that either sex can experience either pattern. So gender doesn't rule the diagnosis. Your unique set of symptoms does. The bottom line, if something feels off, listen to your body.
Section 4, the golden hour. What to do immediately. Okay, this is critical. If you or someone you're with suspects a heart attack, this golden hour of immediate action can be the difference between life and death, or between minor and major heart damage. Step 1. Stop everything and ring emergency services immediately. Don't drive yourself, don't call a friend, don't wait to see if it gets better. Dial 911 or your local emergency number. When the operator answers, clearly state, "I think I'm having a heart attack," and describe your symptoms. Speak clearly, stay calm, and stay on the line until they tell you to hang up. They'll guide you and dispatch help. This isn't the time for politeness, it's the time for direct, urgent communication. Step 2. Chew and swallow 324 milligrams of regular aspirin if you're not allergic. Why chew? Because chewing speeds up the absorption into your bloodstream. Aspirin is a powerful antiplatelet agent. It helps thin the blood and can break up the clot that's blocking your artery, limiting the damage to your heart muscle. It's the fastest, most accessible over-the-counter way to start fighting that blockage. Make sure it's regular aspirin, not enteric-coated, which takes longer to dissolve. Step 3. Sit down, knees bent, shoulders back. This position helps reduce the workload on your heart. Try to slow your breathing, taking deep, steady breaths. This helps your heart conserve precious oxygen, which is in short supply when an artery is blocked. Panicking only increases your heart rate and your heart's oxygen demand, making things worse. Focus on staying as calm as possible. Step 4. Unlock the front door and have someone wait out front with a flashlight or phone light. Paramedics are literally racing against the clock. They waste no seconds guessing addresses, fumbling with locked doors, or searching for the right house in the dark. A clear path and a visible helper can shave vital minutes off their arrival time. Those minutes can mean the difference between permanent damage and a full recovery. Now, what if the person collapses and isn't breathing normally? This is where hands-on action becomes crucial. If they're unresponsive, immediately start hard, fast compressions in the center of the chest. Push hard, push fast, about 100 to 120 compressions per minute, to the beat of "Stayin' Alive." Don't stop until professionals arrive or an AED is brought to you. If an automated external defibrillator appears, don't hesitate. These devices are designed to be used by anyone. They talk you through every step. Apply pads to bare skin, analyzing rhythm, shock advised. Follow its instructions precisely. Early CPR and defibrillation dramatically increase survival rates. Section 5. Why people freeze and how to beat it. It's a common tragic scenario. Someone feels symptoms, but they hesitate. The number one reason callers hesitate is fear of looking silly or bothering emergency services for a false alarm. Let me be absolutely clear. Paramedics would rather revive 100 false alarms than arrive too late to one real emergency. They are there to help, and they are trained to distinguish between minor issues and life-threatening events. Your call is never an inconvenience. So how do you beat that freeze response? Practice what you'll say. Mentally rehearse the steps. If you're at work or with others, use code words. Tell coworkers, "I need the AMBO team for chest pressure now." This way, bystanders treat it seriously, you get the help you need, and you don't have to feel self-conscious. Empower yourself with knowledge, and you'll be ready to act, not freeze.
Section 6. Prevention. The daily armor. The best heart attack is the one that never happens, right? And the amazing news is you have incredible power to prevent it. Think of these habits as your daily armor, building resilience against heart disease. Exercise. You don't need to become a marathon runner. Aim for at least 30 minutes of brisk walking, cycling, or swimming 5 days a week. That alone can cut your risk by a staggering 30%. Regular physical activity strengthens your heart muscle, improves circulation, lowers blood pressure, helps manage cholesterol, and keeps your arteries flexible. It's a miracle drug with no side effects. Diet. What you put on your plate is foundational. Fill half your plate with colorful produce, fruits, and vegetables, packed with vitamins, minerals, and fiber. A quarter of your plate should be whole grain starch, like brown rice, quinoa, or whole wheat bread, providing sustained energy. The final quarter, lean protein, chicken, fish, beans, or lentils, for muscle repair and satiety. Critically, keep your sodium intake under 1,500 milligrams per day to protect your blood pressure. Limit saturated and trans fats found in processed foods and red meats, and dramatically cut back on added sugars. These dietary choices aren't just about weight. They directly impact artery health, cholesterol levels, and inflammation.
Wait, even losing a modest 5 to 10% of your body weight can have profound benefits. This seemingly small change can drop your blood pressure by 10 points, improve your cholesterol profile, and reduce the strain on your heart, making it easier for it to pump blood efficiently. It's about reducing the overall burden on your entire cardiovascular system. Smoking. If you smoke, this is the single most impactful change you can make. Within a year of quitting, your coronary heart disease risk halves. Within 5 years, it nears that of someone who has never smoked. Smoking damages blood vessels, promotes plaque buildup, and makes your blood more prone to clotting. Quitting is a gift you give your heart every single day. Sleep. We often overlook sleep, but it's a powerhouse for heart health. Aim for 7 to 9 hours of quality sleep each night. During sleep, your body repairs itself, including tiny tears in your blood vessels that, if left unattended, can become prime sites for plaque to accumulate. It also helps regulate hormones that impact blood pressure and inflammation. Stress. Chronic stress is a silent killer, fueling inflammation inside your arteries and raising blood pressure. Incorporate 5-minute breathing breaks into your day, practice mindfulness, or engage in hobbies you love. Finding healthy ways to manage stress, whether it's through exercise, meditation, or simply spending time with loved ones, lowers cortisol levels and protects your heart. Screenings. Knowledge is power. Know your numbers. Get regular checkups to monitor your blood pressure, cholesterol, LDL, HDL, triglycerides, fasting glucose, and even your waist-to-height ratio. These numbers don't lie, and catching any unhealthy creep early allows you to make lifestyle adjustments or start medication before those numbers spiral into a full-blown crisis. Prevention is always easier than intervention. Section 8. Myth-busting. Let's clear up some dangerous misconceptions that can cost lives. Myth. Only the elderly have heart attacks. Fact. Absolutely false. While risk increases with age, plaques can start forming in your 20s. In fact, a surprising 1 in 5 heart attacks occur before the age of 50. Lifestyle choices made in youth directly impact heart health in adulthood, so don't think you're invincible just because you're young. Myth. Fit athletes can't drop dead from a heart attack. Fact. This is a tragic myth. While fitness is protective, even elite marathoners and seemingly healthy athletes can harbor hidden blockages, especially if genetics load the gun. Underlying heart conditions or undetected atherosclerosis can lead to sudden cardiac events, even in peak physical condition. Don't assume fitness equals immunity. Myth. Heart attacks always hurt. Fact. This is one of the most dangerous myths. Up to 30% of heart attacks are silent, meaning they occur with no or very mild, non-specific symptoms that are often dismissed as indigestion or fatigue. This is particularly common in people with diabetes or neuropathy, who may have reduced pain perception.
a silent heart attack can still cause significant heart damage, often only discovered later during routine tests. This is why awareness of subtle symptoms and regular screenings are so crucial. Section 8. Emergency checklist to post on the fridge. Make this your non-negotiable, quick reference guide. Print it out, slap it on the fridge, and make sure everyone in your household knows what it is. 1. 911 first, everything second. Don't waste a second, call for professional help immediately. 2. Aspirin next, chew, don't swallow whole. If you're not allergic, get that clot buster working fast. 3. Note the time symptoms started. This is crucial information for paramedics and doctors as it decides your eligibility for certain clot-busting medications or procedures. 4. Keep a list of meds and allergies in your wallet or purse. Emergency responders need this information instantly to provide safe and effective care. 5. Tell someone close where you keep that list. In an emergency, you might not be able to communicate. Someone else needs to know where to find your vital medical information. Remember, seconds save muscle. Preparation can save a life. If this information has spared you even one moment of confusion, if it's made you think differently about that heartburn, then please share it. Share it with your parents, your siblings, your friends, with the person whose hand you'd hold in an ambulance. Hit subscribe for weekly, doctor-checked tips that turn viewers like you into the safest, most informed people in the room. And drop a comment below describing the symptom you now promise never to ignore. Knowledge kept quiet can't resuscitate anyone. Spread it, and together, let's build a healthier, more aware community. Conclusion: you can't schedule a heart attack, but you absolutely can script your response. Memorize the signs, respect the subtleties, act fast, and live long. Go ahead, grill those burgers, chase your dreams, enjoy every moment. And when your heart whispers for help, answer with speed, with skill, and with the calm, unwavering certainty that you already know exactly what to do next. Your life depends on it.